through the intro so I can turn it over to Alexia. So thank you all for joining today. For those of you who don't know me, my name is Rachel Merchant. I'm a Community Outreach Program Manager on the Community Health Team at Northern Westchester Hospital. And many individuals here are part of the Community Care Team, or CCT. And the CCT is a group that looks to serve patients in our community or clients who have complex care needs with linkage to care. And the ask for this presentation topic came about because a lot of our members are experiencing either are unable to access insurance or are not sure if they're able to access insurance. So this became an ask in our community to figure out what are individuals actually eligible for based on their immigration status. How can we best assist our members with accessing the type of care that they may be eligible for? And as we all know, the laws keep changing. So how can we keep current to this information? So I'm very excited to have Alexia Mickles here. I'm going to turn it over to her in just a minute. A couple of basic logistics. Let's please keep ourselves on mute for the presentation so we can focus on what Alexia is going to share. Please, if you have any questions as the presentation goes on, put it in the chat. We'll have some time at the end for Q&A. And I'm definitely going to share the slides after the presentation. We'll aim to share a recording as well. Please share forward with anyone who you feel could benefit from your agency, because we feel the more people that get this information, the better we're able to help our clients and our community. So without further ado, Alexia Mickles is a senior attorney in the Health Law Unit at the Empire Justice Center, and she'll start off by telling us a little bit about the Empire Justice Center. But Alexia, thank you so much for taking the time out of your day to provide us with this valuable information, and I'm not going to talk anymore, so take it away.
Thank you. Thank you so much, Rachel. And thank you all so much for coming. I know Monday mornings are really tough, so I promise not to waste any of your time. Like Rachel said, I'm a senior attorney with Empire Justice Center's Health Law Unit. I'm located in our Rochester office, but Westchester is very near and dear to my heart. I am a Pace Law alum, so I lived in White Plains for a few years. And I'm just going to dive right in. We're just going to get going. I'm going to share my screen. And I will just ask that you let me know, give me a nod if it's looking good. Perfect. Okay. And I'm going to go off camera because I find myself very distracting while I talk, but you will see me again at the end, not to worry. Let's see. Okay. So first, just real quickly about Empire Justice Center. We are a nonprofit law firm that seeks to make the law work for all New Yorkers, especially those who need it most. Our staff has protected and strengthened the legal rights of people in New York, especially historically marginalized communities, for more than 40 years. We do this through three major service areas. We teach the law by providing training and support and technical assistance to legal services and private attorneys and other community-based advocates to help them better serve their clients. We practice the law by providing direct civil legal assistance and undertaking impact litigation, and we improve the law by engaging in policy analysis, research, and advocacy. And like I said, our health team is located in the Rochester office, but we have offices throughout the state, and our team is actually funded to assist consumers and advocates all around New York State, outside of New York City. But if you do have folks in New York City that need assistance, we can direct you to one of our partner agencies. And I am just going to get going. Okay, so our agenda today, we are going to review definitions, concepts, marketplace income eligibility. We're going to go over the definitions of immigrant and benefits related immigration classifications, a public health insurance overview and eligibility for coverage. We'll discuss emergency Medicaid. We'll go over some new updates to the law in 2023, 2024, and we'll provide some resources and where to go for assistance. So first, you might be familiar with this chart, the marketplace affordability programs. We've updated it to include, as you'll see the yellow color there, that is for the Essential Plan, a marketplace affordability program. There has been some changes to the Essential Plan this year, and we are going to go over them, but you might notice this looks a little different than this chart has looked in the past, because the Essential Plan has been expanded to cover those with a little bit higher incomes than in the past years. So just wanted to show that to start so you can see what the income levels are for each of these marketplace programs. And now a few noteworthy definitions. So I do want to preface before I start talking about immigration and benefits related classifications I am a health law attorney. I am not an immigration attorney. So I do not hold myself out to be an expert in immigration law. That is not what this is. Our goal is to share with you some information about how immigration status can affect eligibility for public health insurance. I would still encourage folks to seek the assistance of an immigration attorney for any specific immigration related questions. But real quickly, the Immigration and Nationality Act uses a definition of exclusion. It's kind of confusing. So everybody who is not a non-immigrant is an immigrant. And what that means is there's three different categories here. We've got a non-immigrant. That would be someone who is an alien who is admitted to the US for a specific period of time, that there are clear conditions on their stay. And there's a large variety of non-immigrant categories, and each exists for a specific purpose. Think of a visa, like a specific visa. Then there's non-citizens. Those are people without US citizenship or nationality. They might be of a different nationality, or they might be stateless. The term is also synonymous with a foreign national or an alien. And then there's lawful permanent resident. This is any person who's not a citizen of the US, but who's living in the US under legally recognized and lawfully recorded permanent residence. You might hear the phrase permanent resident alien permit holder, or more colloquially, a green card holder. Those are lawful permanent residents. Their residency may not actually entirely be permanent, but the intention is that it is. But you can lose LPR status if you're out of the country for longer than 6 months or convicted of a particularly serious crime. Just want to note that. I know that was kind of a lot, and it seems like a lot, but hopefully it'll make a little bit more sense as we go into the next few slides here. So what are the benefits related categories? So these are not immigration statuses. They are classifications used to determine public benefits eligibility. There's qualified aliens. Those are non-citizens whose eligibility category was created in 1996 under welfare reform. And these are classes of non-citizens who are eligible for federal public benefits, including Medicaid. There's PRUCOL, that stands for permanently residing under color of law. It's sort of a catch-all category, and it's used in New York only to describe those who are not qualified aliens, but they're here with knowledge and permission or acquiescence of immigration. New York has added that category as a catch-all to sort of expand public benefits eligibility to another group of people that the federal government does not. Then there's lawfully present. These are non-citizens whose eligibility classification was introduced in 2008, and it covers children and pregnant women in CHIP and Medicaid. The Affordable Care Act adopted this as the immigrant eligibility classification for qualified health plans and the essential plan as well. Again, I know that is a lot. I'd encourage folks to check out our immigrant health coverage crosswalk at that link below. I do have a couple screenshots in there throughout the training as well, so we will take a look at that. But now we're going to talk a little bit about public health insurance programs. We'll do a quick overview, and hopefully most of this is review for folks. We're going to quickly talk about Medicare, which might sound a little bit surprising since we're talking about immigrant eligibility. But Medicare is a federal health insurance program for people who are 65 and older. It's available for younger people with more than 24 months of Social Security disability insurance. It's also for people with end-stage renal disease or ALS, which I forgot to put on there, or this is our catch-all, if otherwise in receipt of any Social Security benefit. So if Social Security has deemed you eligible for a benefit, a specific Social Security benefit, you would automatically be entitled to Medicare. Older adults age 65 plus will qualify for premium-free Part A coverage. If you are insured through Social Security, you can also be insured through your spouse. Plus, you qualify for Part B hospital coverage and Part D prescription drug coverage. If you're not insured and don't qualify for premium-free Part A, you can still qualify for Medicare if you have lawful permanent resident status and 5 years of continuous residency, but you might have to pay for Part A. So basically, you qualify for Medicare even if you're not a United States citizen, if you qualify to receive or currently receive Social Security retirement benefits, railroad retirement benefits, or SSDI. And you would qualify for premium-free Part A and owe a premium for Part B. So I know that was a lot. That was just really quickly about Medicare because Medicare isn't quite the topic of this discussion today, but I did want to put a little bit of that information out there. And I'm happy to answer questions after the training if there's any specific Medicare questions afterward. Also really briefly going to go over the New York uninsured care programs. Hopefully this is a little bit of review for folks, but this is a federal grant administered through the New York Department of Health to provide access to HIV-related healthcare for uninsured individuals or underinsured individuals. There's 5 programs. There's ADAP, the AIDS Drug Assistance Program, ADAP Plus, HIV Home Care, APIC, that's ADAP Plus Insurance Continuation Program, and then PrEP-AP for pre-exposure prophylaxis. The eligibility is for these programs, for all of them, is that you must be a New York State resident. You must be living with HIV or at risk of acquiring HIV. And there's specific guidelines on to who is at risk of acquiring. There's no immigration requirement though. So immigration status is not a question. It doesn't come into play. You just must be a resident of New York State and you must have an income up to 500% of the federal poverty level. There's no resource limit for this program either. You can apply at that link right there. It's actually a really user-friendly, really helpful, informative site. I encourage folks to check it out if they haven't seen it before. And it's the same form and enrollment process for all the programs, but there's some additional forms required for 2 of them there. And we also left information for the hotline. If you have any questions, you can give them a call as well. All right, Magi Medicaid. I'm sure a lot of folks on this call are very, very familiar with Marketplace Medicaid, available to childless adults age 19 to 64 without Medicare, available to children, available to parents and caretaker relatives of children. You can be 65 plus and or on Medicare if you're a parent caretaker relative. Also available to pregnant women who could also have Medicare. You would apply through the New York State of Health. We left some information there if you need assistance. Some of you might be navigators though, so I'm sure you're very familiar. There are higher income limits for pregnant women and children. And the way that income is calculated is different than in the non-Magi Medicaid program, which we'll talk about in the next slide. But not countable income includes workers' compensation, child support that's received, veterans benefits, and most SSA dependent income. I just want to note again, because we've gotten a lot of questions on this in the past, but child support received is not countable for Marketplace Medicaid. Unfortunately, it is countable for the payer. So if someone owes child support, that cannot be excluded. It's still included in their income. There is no asset test, and there's also no spend down available for adults 19 to 64, unlike the next program here, non-Magi Medicaid, or DAB, as some folks call it, for the disabled age 65 plus and blind populations. Still a paper application process through the local district and HRA in New York City. Also known as SSI related Medicaid. There are income and resource limits. We put the income limit here. As of 2023, I believe was the first year, the income limits are the same for non-Magi and Magi Medicaid due to some advocacy at the state level. Unfortunately, like we just said on the previous slide, income is still calculated very differently. So that can be very confusing. And there is still a resource limit for this program, although there is advocacy at the state level to try to increase and eventually eliminate this resource limit Nothing's happened yet, but I just wanted to let you know that there is something in the works. There's a bill moving throughout the state legislature, that there's hope that that could happen someday. So we'll see. There is a spend down available if you have excess income and resources. And then this slide right here is just, it's not even all inclusive. I sort of selected a few of what I think are relevant programs and left a couple of them out, but this is an attachment to an administrative directive from the Office of Health Insurance Programs that shows you the difference between MAGI and non-MAGI Medicaid populations. I find it really helpful when I'm trying to figure out where someone might be, where they might be getting their Medicaid already, if they're not sure where they could be going to apply for Medicaid. Of course, that is all with the caveat that we're after the public health emergency, there may be a lot of folks whose Medicaid cases are living at the New York State of Health, even though they might be eligible for non-MAGI Medicaid, and vice versa. There's just some confusing things going on with transitions right now, but that is a whole training in and of itself. So I don't want to go into that. I just, like I said, I like to refer back to this sort of graphic whenever I'm getting myself a little bit confused. And now the essential plan. So like I said, there's some significant changes this year we'll talk about on the next slide. But this is health insurance coverage for New Yorkers, available for no deductible, no monthly premium. We put a link there to the cost sharing chart, but it's all relatively very low cost sharing. It's for New York State residents who are not eligible for Medicaid, not eligible for Child Health Plus, not eligible for qualified health plans, or affordable employer coverage. Essential Plan 1 or 2 are available to those who are lawfully present, including qualified aliens and those who are PRU-call. It is also available to PRU-call only. It is also available to non-citizens residing in the US with knowledge and permission or acquiescence of immigration. The Essential Plan 3 or 4 is available only to some lawfully present populations, only if they're not eligible for federal Medicaid or Medicaid through the local district. And these individuals may need employment authorization. Now, the sort of 5th level of the essential plan that's new, effective of April 1st this year, is they're calling it EP 200 to 250. I may start just calling it EP 250 just because I think that's a little bit quicker for this training, but it is officially called EP 200 to 250 by the New York State of Health. And what this is, new for 2024, is the upper income limit for essential plan increased from 200 to 250% FPL. Approximately 70,000 people enrolled in qualified health plans who had income within that range became eligible and transitioned to premium-free essential plan, which is awesome. And we put a link there to a New York State of Health toolkit and some FAQs to answer some of those more specific questions about how that's been working in the background. Effective August 1st, immigrants with deferred action for childhood arrival, also known as DACA or Dreamers, individuals with that status with incomes between 0 to 250% FPL will be eligible for the essential plan, as well as any other lawfully present immigrants who are already eligible under the current program rules. So that's also some very exciting news. And we have put some links to some further a sister training from the New York State of Health and some further information on New York Health Access. And starting in April of 2024, consumers who are currently enrolled in Essential Plan and report their pregnancy can now remain enrolled in their EP plan, their Essential Plan. The purpose of the change was to maintain continuity of care for pregnant consumers. Pregnant individuals with income below 223% FPL can still request to be evaluated for Medicaid. And newly applying pregnant consumers with no coverage will be evaluated for Medicaid up to 223% FPL. So again, a new essential plan benefit that's very, very exciting and very helpful to New Yorkers. And hopefully this helps a little bit about what I was saying before about all the different essential plan levels. We've got EPs 4, 3, 2, and 1, and in that order, even though that doesn't quite make sense. That is the different income levels. They go up as you go down. And the highest income level, like we just talked about, is for that EP 200 to 250, that new program. And of course, as always was true, the eligibility is based on MAGI income and household size. Now, here is, I know this looks a little confusing. This is actually two images next to one another, where this photo on the right, imagine it going below the photo on the left. So it's one long report, one long chart here. This is our health coverage crosswalk. And hopefully this is a little bit helpful in showing. You'll see on the left the benefit related immigration classification. So that's the terms lawfully present, excuse me, qualified aliens, and PRUCOL that we've talked about. Now, if you go one more column over, you'll see immigration status. Look at all of these different immigration statuses. So qualified aliens make up, I think there's like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There's at least 10 different immigration statuses who are considered qualified aliens. They're also lawfully present. Every single status on this chart is considered lawfully present. Some of them are PRUCOL, some of them are qualified aliens. And if you keep going to the right, you can see what they might be eligible for. We didn't put any more screenshots of this chart and the training, not because we don't love it. We absolutely love this chart. We refer to it all the time, but it is in need of some updating, as we just discussed the essential plan, and there's some Medicaid changes that have happened this year that we'll get to a little bit later. So I didn't want to refer to you guys to this chart too often, even though that's normally what we do, just because there are some changes, and it's a very big project to implement these changes on this chart. But I did provide the link. It's in the beginning of the training. I pointed that out. So I'd still encourage you to check it out because it is helpful in seeing the benefits related classifications and how they relate to immigration statuses. Hopefully, as soon as it is updated, I can promise to let everyone know and share an updated link. So again, like I was just sort of saying, but hopefully now this is a little bit easier to see now that we've seen it in the chart. Qualified aliens can include any of the following, and this is not an exhaustive list: lawful permanent residents, refugees, asylees granted withholding of removal. There's also a category for Cuban, Haitian entrants who entered the US with parole status after October 1980. Individuals granted parole status of at least 1 year. You might have heard the term T visas. T visas are for victims of severe form of trafficking. You might be familiar with the phrase VAWA, or Victims Against Women Act. That's for the battered spouses and children. They were petitioning under VAWA. It also can include lawfully residing armed service members and veterans. So these individuals are all qualified aliens and might be eligible accordingly to public benefits. Qualified aliens and the 5-year Medicaid bar. So the rule is, it's a federal rule, individuals cannot receive Medicaid in the first 5 years that they are in qualifying alien status. Instead, in New York State, these individuals can get Essential Plan 3 or 4 with a partial Medicaid wrap. Basically, the individuals would be eligible for Essential Plan 3 or 4, and they receive a Medicaid card to obtain 2 wraparound Medicaid services. That's non-emergency medical transportation and the ability to obtain family planning and reproductive health services from any Medicaid provider. There's more information at that link. Just wanted to explain what that meant. This is all for during the 5-year bar, the federal bar. It applies to lawful permanent residents, individuals paroled for 1 year or more, and battered spouses and children petitioning under VAWA. There's always exceptions though, like, right? I know you're all very familiar with how health insurance works and how there's always exceptions and exceptions to rules and exceptions to those. Children under 21, pregnant women, effective April 2024, consumers who are currently enrolled in EP and then report their pregnancy, like we said before, can either remain enrolled in their current EP plan or be reevaluated for Medicaid. So it's always important to ask those questions when you're dealing with a patient. Are they a child? Are they pregnant? Because that will change their eligibility regardless of immigration status. So coverage availability for qualified aliens. Again, this is all in that chart, in the images of the chart I showed you, but we just wanted to also show you in it a different way. Qualified aliens might be eligible for Medicaid, might be eligible for Child Health Plus, Essential Plan, QHPs with or without tax credits, and the uninsured care programs. Individuals who are lawfully present, similar to what we just did with qualified aliens. This is, again, not an exhaustive list. Non-citizens in a qualified alien status, non-immigrants, DACA, temporary protected status, that's what TPS is, applicants for special immigrant juvenile status. That is also that's a phrase you might want to be familiar with. Another phrase I would want to be familiar with is the last bullet. Applicants for the following who have employment authorization documents or a work permit. These applicants for asylum, applicants for temporary protected status, applicants for registry, applicants for withholding of removal or cancellation. So I just want to point that out. And again, it is in the crosswalk, but not only does your immigration status affect your benefits related classification, but even applying for certain immigration statuses can change where you are on the benefits related eligibility. Yes, I hope that made sense. If it doesn't make sense, somebody just ask a question in the chat. But just important to note, not only does your immigration status matter, but if someone might not be aware of their immigration status, or they say, well, I'm not sure, but I applied for this with my immigration attorney, now you know where to find them on our coverage chart, right? Now you know that might be a different location than what you were thinking before. Maybe they're not undocumented. Maybe they are just applying for something else. And we will talk a little bit more about that a little bit later too. Okay, coverage for lawfully present individuals who are not qualified aliens. These individuals might be eligible for non-Magi Medicaid if they're under 21 or they're pregnant, or if they're applying for special immigrant juvenile status. They might be eligible for Magi Medicaid. They might be eligible for Essential Plan 3 or 4 with that partial Medicaid wrap. They might be eligible for Essential Plan 1 or 2, might be eligible for QHP, Child Health Plus, or uninsured care programs. Non-citizens who are PRU-call only. So applicants for an immigration benefit who do not have employment authorization. Registry aliens without a pending permanent residence application. Immediate relatives with an approved I-30. They might have a pending application for I-551. These forms, I do not expect anyone, I have to look up these forms every time someone says that they're trying to explain what their immigration status is and that they have a form. I still have to look up these forms. We are not here to do these forms or to memorize these forms. I'm just writing this all out for your reference. So if someone comes to you at the hospital and they say they have certain forms on them, hopefully you know now where to look and where you can sort of see what their eligibility might be. These individuals are PRU-call only. There is a section on our chart for individuals who are PRU-call only. And it's all of these categories here. So like I said, I realize I'm sort of throwing all these phrases and these form numbers out to you. That is not expected to be memorized or anything, but hopefully you know where to look for these where these individuals may fall on our chart. Also, what's relatively new in the PRU-Call only status, and I put some more information on these links, is someone who has an official request for deferred action pending for 6+ months and wasn't denied. Originally, it was unknown what they might be PRU-Call only. Now, there's a new rule that says if you put in a request for deferred action, which is something that someone would do with their immigration attorney, 15 days after submission, regardless if they haven't heard back from immigration, because everything moves slow, they are officially PRU-Call only. That is the guidance right there. Basically, the Department of Health revised its policy because it was just taking so long, and they wanted a way to get more people eligible under this PRU-Call only status. Again, I don't really expect anyone to have that memorized, but I'm just putting these phrases out there and including these links again, so hopefully it is easy to go back and look for some answers. Excuse me. Coverage for PRU-Call only. PRU-Call only immigrants might be eligible for MAGI Medicaid. Non-MAGI, if they're an applicant for special immigrant juvenile status. Essential Plan 1 or 2 and QHPs, Child Health Plus, and Uninsured Care Program. Again, I know I'm saying Child Health Plus and Uninsured Care Program at the end of every single status, and that's because, as we discussed, immigration status is irrelevant for those programs. Okay, and now, so applying for Child Health Plus. This might be a refresher for some folks. It might be something you do every day. Just wanted to go over this quickly, that all children under 19 are potentially eligible for Child Health Plus, again, regardless of immigration status. They are required to provide proof of the child's age and identity, New York State residency, and income. You can prove residency with pay stubs, a letter from an employer, a mortgage, a lease, or a rental agreement, a letter from the child's school. Applicants and non-applicants will be asked for their social security number, but will not have to provide if they don't have one. And we'll talk about this more on the next slide. In general, families with marketplace eligible and ineligible members. So this is called like a mixed immigration status family, right? So an ineligible family member or a non-applicant, think of maybe a parent who might not be eligible for marketplace coverage, may complete an application on behalf of an eligible family member who is the applicant. Think of a child. During the application process, the applicants and the non-applicants can be asked for their social security number, but they're not required to provide one if they're not eligible for one. Unfortunately, you might be familiar with a TIN, the taxpayer identification number. Unfortunately, that can't be used in lieu of social security number. The citizenship or immigration status of an individual who is not seeking coverage for themselves is not relevant for the application. And a non-applicant should not be asked questions or required to provide any information about their status. Verification of status through the Federal Data Hub. So marketplace and counties match info on immigration documents with data in the Department of, in the DHS records, in the Department of Health and Human Services records. They use what's called the SAVE system. I do not know what SAVE stands for. Oh, it stands for Systemic Alien Verification of Entitlements. That is what SAVE stands for. There is a DOH documentation guide for citizen and non-citizens eligibility for health insurance coverage. Some most common documents you may need are an arrival departure record. Again, no need to memorize what a 994 is. Once you see it once, you'll remember it every time, because it really is, it just has sort of a stamp on it that says when someone arrived. A permanent resident card, an employment authorization card, a visa and a foreign passport, or a notice of action. And those DOH document guide and the link above, it sets out a very detailed list of the documents that can establish a person's immigration status when applying for public health coverage. States will be able to verify citizenship and immigration status, as well as income and residence for most applicants through interaction with that new federal data hub. So, a reminder also that applicants for emergency Medicaid only, they don't need to have their immigration status verified. So anyone attesting to the status of other does not have their info verified, and as a result, they're potentially eligible only for emergency Medicaid. They might also be eligible for CHIP, right? They also might be eligible for a new Medicaid expansion for individuals who are over 65 in New York. Basically, when you apply, you don't specifically apply for coverage under emergencies, but that's what happens when someone attests to a status of other on their application. Okay, so immigrants without status in 2024. Immigrants without status are defined as basically two different categories, two different populations. EWI, or those who have entered without inspection. That's for individuals who came into the US at a place other than a port of entry and without inspection. Or visa overstays. Someone entered the US with a visa, but stayed after their visa expired. So their eligibility, this also might be, you also might hear the phrase undocumented. This is actually for individuals who are undocumented. This is what that means. People might say undocumented and they might not realize that they actually do have a document that is relevant. And we'll talk about that a little bit later. But this is literally immigrants without status is the proper phrase for someone who is known as undocumented. And their eligibility for New York State health insurance is going to be limited. As you can see, and hopefully this makes sense from what we've talked about throughout the training, they might be eligible for Medicaid if they're pregnant, right? They, of course, would be eligible for Child Health Plus if they're under 19. Now, I've circled it, but this is new in 2024. If they're over the age of 65, they are now potentially eligible for non-Magi Medicaid. All others, emergency Medicaid only. And we will talk a little bit about all of this on the next few slides. So what is emergency Medicaid? This might be review for a lot of folks. Maybe it's new for some, but this is not comprehensive coverage. It provides medical payment for care and services only if you need immediate medical attention for a serious health issue. This includes costs related to kidney dialysis, emergency labor, emergency delivery, medications that are necessary in an emergency. And I do have a link if someone wants to know exactly what those medications are. There is a link through the Department of Health that shows all those medications. It's not a lot, but there is a list to those medications. And I forgot to include it on here. So if someone does want that, let me know. It's available to uninsured, undocumented New York State residents who would otherwise be eligible for Medicaid. They must otherwise meet the eligibility for medical assistance financially. They must be financially eligible for Medicaid. And remember, it's emergencies only. We put a link to a little bit more information. Options to apply. You can apply anytime through the New York State of Health if you're under 65. You can enroll in advance and you'll be approved for costs of future qualifying emergencies for 12 months. But the key word being qualifying emergencies, not just any emergency room visit, but it has to be a qualifying emergency and the burden is very high. You can also apply at a hospital during or after an emergency. You must sign up within 3 months of the emergency treatment. Retroactive coverage up to 3 months is available, but just like any other Medicaid application, you must request retroactive coverage if you're applying after the emergency. You need proof of identity, proof of income, and state residency. And again, reminder that applicants who are just applying for emergency Medicaid only, they don't need to have their immigration status verified. And now the Medicaid expansion. So the 2022-23 enacted budget expanded coverage to include comprehensive health coverage for undocumented seniors, immigrants without status, age 65 or older, using state-only funding. This change will allow this new population of New Yorkers to access all services covered by mainstream Medicaid managed care plans. So now, emergency Medicaid is only available to undocumented New Yorkers 64, actually ages 19 to 64, who would otherwise be eligible for Medicaid, but for their immigration status. Remember, they don't need it if they're under 19 because they'd be eligible for CHIP. As of December 2023, if an undocumented senior was already on emergency Medicaid through their local district or HRA, they were automatically transitioned to the New York State of Health Marketplace. These folks should have received a letter from New York State back in November, alerting them to the change, what they can expect, and to tell them how to select a managed care plan. And there's some more information at that link below. We'll talk a little bit more about this on these next few slides. Effective date was January 1st, 2024. So for undocumented New Yorkers who were already on emergency Medicaid in 2023, if that individual picked a managed care plan by the end of December, they were enrolled by January 1st. If they did not pick a managed care plan, they were auto-enrolled into a plan effective January 1st. And that was DOH's way of trying to get folks into a plan by the 1st as quickly as possible, as many people as possible. If you become aware of any individuals with emergency Medicaid at the end of 2023 who were not automatically transferred to NYSO and were not enrolled in managed care effective January 1st, you can let us know. These cases can be escalated to DOH for review. What about new applicants? So what about undocumented New Yorkers 65 plus who were not already on emergency Medicaid in 2023? They would need to apply through their local district or HRA to determine initial eligibility, including New York State residency, income, and resources. If the initial applications will need to be, the initial applications will need to be submitted by paper through local district, HRA, just like the non-Magi applications. If they're eligible, the local district or HRA will authorize coverage using coverage code 07, that's the code for emergency Medicaid, and they will transfer the case to the New York State of Health. Once the case is transferred to NYSO, the eligible individual still needs to now choose and enroll in a plan before they will have the new expanded coverage. And until then, emergency Medicaid and NYRX pharmacy benefits are all that they will be able to access until they're enrolled in a plan. That's because those are carved out of managed care. They could have emergency Medicaid, which is all they would be eligible for, and then the pharmacy benefits, since that was carved out of managed care, transitioned out of managed care. So basically, why this is happening like this. So the New York State of Health has federal authority to do redeterminations, but not applications for the non-Magi folks. So that's why NYSO will handle all the redeterminations each year. They have more staff, they have more resources to do the redeterminations. But they still need to apply. These folks need to apply through their local district because it still is in the background a form of non-Magi Medicaid, if that makes sense. It's just that these cases are going to be transitioned and held at the New York State of Health so that the New York State of Health can help with redeterminations every single year. Also on this slide is some information about how the individual enrolls in a plan and how that typical 15th of the month rule applies from here on out. So if someone enrolls in a plan on the 15th, their plan enrollment is effective the 1st of the following month. If someone enrolls in a plan on April 16th, their plan enrollment will not be effective until June 1st. If someone does not select a managed care plan at all, they're going to be auto-enrolled approximately 10 days after their case transfers to the New York State of Health. So if their case transfers on the 15th, they're going to be auto-enrolled in a plan 10 days after that, which means their coverage won't be effective until the first of the following, the next following month. It's still that 15th of the month rule. So this could be a long lag. As you can see, someone applies, it might be a while before they're actually enrolled in a managed care plan, just because of the way these dates fall. What about folks who are going to age into this expanded coverage? So only new applicants need to apply at the local district for this expanded Medicaid coverage, but individuals with emergency Medicaid coverage in NYSO will be identified the month before they turn 65. Basically, the system will flip the individual from emergency Medicaid only to Medicaid managed care eligibility the first of the month after the month in which they turn 65. So if I turn 65 this month, today, I'm not going to be determined eligible for managed care until the 1st of July. If they don't select a managed care plan, they'll be auto-enrolled approximately 10 days after that flip. And then it's the typical NYSO 15th of the month rule. So if the individual enrolls in a plan on or before the 15th, effective date of enrollment is the 1st of the following month. And as an example, let's say Anna has emergency Medicaid on New York State of Health. She turns 65 in April and will be eligible for expanded coverage. The system will flip to Medicaid managed care eligibility, and it will happen on May 1st, and she can enroll in a managed care plan. Her new coverage will be effective June 1st. So again, kind of a long lag, long delay, but ultimately very, very good news and very exciting for this population to have this coverage now available. The benefit package, once enrolled, the newly eligible population will have mainstream managed care benefits. Any benefit carved out of managed care after January 1st, 2023 will be made available to these consumers on a fee-for-service basis, like pharmacy benefits, like the NYRX program. They can access NYRX like any other managed care enrollee. Non-emergency transportation was carved out of managed care, but before January 1st. So consumers do not have access to non-emergency transportation like managed care enrollees. That is the one difference. But what about nursing home coverage? Yes, this coverage includes nursing home benefits. So those eligible for the new coverage are also entitled to nursing home benefits available within their Medicaid managed care plan if they are financially eligible under existing rules used to determine coverage of long-term nursing home care. By existing rules, we mean the 60-month transfer of assets look back for the application of a transfer of assets penalty period as applicable. So that's that 60-month look back for long-term care. New York State of Health cannot determine eligibility for nursing home coverage. So these cases are going to be handled differently with DOH staff processing. All documentation related to nursing home eligibility for this 65 plus undocumented population should be sent by email to mc465plusundoc@health.newyork.gov. And any documentation received by DOH staff to determine eligibility for long-term nursing home coverage will be uploaded to a consumer's NYSO account. DOH is working on communicating this process to nursing homes, as well as the messaging surrounding potential public charge implications. Basically, I don't want to go too much into public charge. I think we're going to actually talk about it in a couple slides, so I'm just going to leave it like that. And we will talk about this a little bit further. Will this coverage be retroactive? Comprehensive retroactive coverage, unfortunately, will not be available for this population. However, up to 3 months of retroactive emergency Medicaid plus NYRX pharmacy benefits will be available for new applicants if they are eventually approved for full Medicaid. This is being grandfathered in with the start of the program. So 1 month of retroactive emergency Medicaid and NYRX was available if someone was found eligible in February. 2 months of retroactive Medicaid and emergency Medicaid and NYRX were available if someone was found eligible under this program in March. And 3 months retroactive will be available moving forward.
So Alexia, we're at 51. Can I actually ask if you would do slide 40, the public charge fears?
Absolutely, yes, sure, I will do that. And I sort of talked about this one before, so we will go right. Yes, public charge fears, really good idea. So public charge is an inadmissibility test that allows the United States government to deny a person's application for admission to the United States, to deny them for their green card or extension of a visa, if it's determined that they are likely to become dependent on the government for support. What does that mean? So, well, to be dependent on the government for support, only certain public benefits are considered. SSI, temporary assistance and safety net assistance in New York State, and then long-term institutionalization, that is a federal phrase. What that means is Medicaid nursing home care. So receipt of these benefits doesn't automatically make someone a public charge. It doesn't mean that you are a public charge. The determination is based on a totality of the circumstances. So while Medicaid, like generally speaking, Medicaid coverage is actually specifically excluded from a public charge determination, but Medicaid long-term care is included in this analysis. So happy to take any questions on that. We have 7 minutes left. I'm just going to show my camera now, and we can go through any questions. I'm so sorry if that felt rushed. I just wanted to get you as much information as possible. And yes, let's see what we got here in the chat.
Feel free to add questions in the chat. If you want to raise your hand and come off mute, that works too. Alexia, there was a question about the resource sharing. Do you want to pull up that last slide just to talk about where you can serve clients? And then I'll also add the Neighbors Link legal services in the chat, because I know you cover certain areas.
Yes, absolutely. Let's see here. So real quick, this is resources for immigrants just generally. I would highly encourage folks to call or to encourage patients to call this Office for New Americans toll-free legal assistance hotline. They can provide immigration information and referrals. So that's where I would encourage you to send folks that have immigration questions. And then here is our contact info. So for help on immigrant-related or non-immigrant-related health insurance questions, this is our Empire Justice Center's Health Law Unit voicemail box and our email that is always monitored. Our immigration unit is listed here as well. They can provide potential representation to an immigrant victim of crime. They must be a victim of crime that is where the crime has taken place in the US. And they can only assist folks in the lower Hudson Valley region and Long Island only because of some funding restrictions. And then there's also some potential immigration representation to clients in Westchester with some more information at that link. So,
and then I also just added in the chat, Neighbors Link has legal services for our local districts if they don't fall into these categories. So just to be comprehensive. Yeah.
Yes, awesome. And
I'll share all of this via email as well after the presentation. Claire has a question from our Community Center of Northern Westchester. If a CBO has a client who needs medical attention, do the medical providers, we refer them to help with the navigation and application for these benefits? So Claire, are you asking, I think, if the providers of the medical clinics can help them apply for benefits? So Claire, do you want to clarify that question?
Sorry, yes, it's just that question that obviously, I mean, this presentation is fantastic and thank you so much, but it highlights how extraordinarily complicated the system is and how one would need to have a lot of information, education, expertise in this field to really help somebody to know where they are and what they can access. And how would we, as a non-medical provider agency who meets with people who have medical needs, guide them in getting the appropriate assessment and application?
So that's a really great question. And I think that is honestly part of the problem that we see, which is that there are a lot of services and resources available, but it's not smooth and it's not generally applicable. It's, sort of piecemeal depending on your location and whatever. So if you're talking about just applying for marketplace coverage, there are folks at the New York State of Health, there are navigators there that you can refer to that can speak different languages and can assist with those applications for any marketplace program. If you're looking for assistance on a health insurance question, appealing a service denial, a billing issue, a coordination of benefits issue, that you can always refer those cases to us. But yeah, I mean, we refer to the New York State of Health Navigator program for assistance with applying. If that person that you're working with is considered disabled, aged, or blind, we refer to the facilitated enrollers. I'm trying to see if I have that. Did I put that information on the resource slide? Yes. For assistance applying for the disabled, aged, blind population, you can contact a facilitated enroller, and there's links right there. And then our slide on Magi Medicaid at the beginning, there was a link to the Navigator program. So you can find facilitated enrollers and navigators in every county in the state. I hope that was helpful. Did I address the question?
Yes, thank you very much. That's very helpful.
Good. Okay.
So we have 2 more questions. Alexia, can you stay a couple minutes? Because I know we're almost at time.
Course.
Okay, awesome.
Of course.
So Jody, did you want to come off mute to ask your question?
Yeah, I think
I want to make sure I get it right.
I just unmuted. Can you hear me?
Yeah, we hear you.
Okay, first of all, thank you, Alexia. That was a great presentation. I work with Neighbors Link and with families participating in the MRAP program. Are you familiar with MRAP, the Migrant Relocation Assistance Program?
Okay. Yeah. Okay.
Yeah. So through this program, we are moving families out of New York City shelters and into apartments in Westchester County. And in specific, I've had a lot of challenges in moving their health insurance benefits from the city to Westchester. Huge challenges, actually, in getting cases closed, because before enrolling them in the marketplace, they have to show us closed in the city. One client in particular, I've been trying to do this since January. I even went in person to Queens to close her case, and she's still showing as active. So I was just wondering if you have had experienced this problem with any of your clients, or have any advice on how to expedite closing cases, or if anyone else on the Zoom has had this problem and has any advice for us, because it's really been a challenge for some, but not all of the families. Some show up as closed and some don't. And then they're stuck with no insurance because we can't get them enrolled in the marketplace.
Of course. Yeah. And we have seen that. It does require a lot of advocacy with the district that they're moving from. So for New York, obviously, like dealing with HRA, I do believe our partner agencies in New York City might have some better contacts with HRA that you can try to connect with.
Could I email you or get any of those? I've tried to advocate so many times.
Absolutely. No, this is an incredibly frustrating situation. I have no other extra ins for you, but let me give you the Legal Aid Society. Do you work with Legal Aid Society in New York City ever?
I haven't, but I can reach out to them.
I can put their health law unit info in the chat. I will do that. And that's who I recommend starting with, because either them or NYLAG, they have more HRA contacts. And I think it really does come down to just finding the right person and getting them to listen to you.
Yeah, it's been really frustrating. I'm sorry, what is NYRAG?
NYLAG is the New York Legal Assistance Group. So both NYLAG and Legal Aid Society are also nonprofit civil legal services law firms, and they are both solely based in New York City.
Okay, great.
Thank you. Any other questions? Janita, I don't know if you had a question.
No was a question, was for Claire and the medical portion. So at Open Door, we do have the CAC, that is the certified enrollers. So if the patient is in the clinic and needing to apply for medical insurance, or they get referred for emergency surgery, or they have to have a procedure and they don't know how they're gonna be able to afford that. So we help with the application process. And if they have questions about immigration or anything, how it will impact, then in general, we made the connection with the different like legal agencies, including like some of the numbers that Alexia like just shared during the PowerPoint.
Perfect. So Open Door can be a resource as well.
Thanks, Yanira. That's super helpful, because that's the case. If somebody needs their medical attention and you guide them to where to go, will all of this be addressed on arrival? And so that's fantastic to know that you do.
Stephanie,
you.
do you want to add to that?
Yeah, I just want to thank you, Janita, for that, because I think, you know, to Claire's point, I think part of the problem for us as providers in assisting the families and connecting them to different resources is who is the right person to connect the families to, right? Because what we have seen a lot of is undocumented clients who are being approved for like these temporary insurances, like 6 months. But then, you know, we're finding out that they shouldn't have qualified for that to begin with. And then it poses an issue, because when they apply for their immigration case, there may be, you know, an issue with that, because they, you know, technically they weren't supposed to be approved for that insurance. Does that make sense? So our issue is, who is the right person that we should be referring these clients to, so that when they meet with this person that's assisting them in applying for insurance, for that to be done correctly. You know what I mean?
So when we encounter those scenarios, we basically like educate the patient about what happened in the application, trying to clarify anything that might look like unclear on the application. We might ask them to basically like provide any documentation. As they show in the screen, there is tons of like different codes and a lot of different options in terms of basically like where someone could fall depending on their status. So, and we educate them if they have questions about like how that's gonna impact them or what happened or etc. So we provide them with the legal resources, and we might connect them with some of the non-for-profit agencies so they can like go over their questions, because we know legal. We would then provide whatever other options are available in terms of their medical care, including like for access to medication and everything. So of course, nothing is perfect. So there are going to be some scenarios where they're going to be able to get more affordable options, versus there is others that there is no such affordable options. And then with the specialty care, so goes the same. So there is times where they might have emergency Medicaid, and the office might be able to get a pre-authorization depending on the reason, the type of service that they need. But there is times that basically they have to go self-pay out of the pocket, and the reduced fee don't look affordable at all. And we try to connect everybody with places that have financial assistance programs, so they can even explore the options of basically paying based on their income. But again, like it is really complex. We navigate the patients like all the way from basically like trying to find a place to understanding how much gonna cost. But there is times that even with those options and that navigation, they might feel that is not affordable, because that is the truth. Healthcare is expensive right now.
Thank you, Janita. And it's a really complicated system. And I think, you know, you using and sharing all of our resources together the best we can, both to be preventative, getting someone set up with a navigator from New York State of Health at the beginning to try to make sure it's done the right way, but also being reactive if we need to be on the later end and connecting them with legal resources. I think that comprehensive approach.
Also, I just wanted to add that there were some really positive changes to the hospital financial assistance law this year too. So it's supposed to be a uniform application at hospitals across the state. Immigration status is not supposed to be considered. And there have been some significant changes to those prices for folks based on their income, so that hopefully it's not going to be you know, 90% of someone's income in order to pay for an appendectomy for the year. So I don't have like all that information handy on me right now, but there will be a webinar coming up in the near future by Community Service Society in New York City about the changes and the positive changes. And I can share that information with you, Rachel, as soon as I get it.
Absolutely.
Because
I'll
I think
share
that
it.
also might be helpful to a lot of folks as well. As a
That'd be
last
great.
resort, like, right? It's not a fix, but it's a little Band-Aid.
Yeah. Well, thank you. And I know we're over time. If anyone has to go, we totally understand. But Alexia, thank you for staying on. That was an awesome presentation. Are there any further questions before we close? Going once, going twice. All right, well, I will be sharing the slides. I will share Neighbors Link legal consultation resources. If there is anything specific that's missed or any questions that come up, please feel free to reach out and email me. Alexia, that was awesome. It's such a complicated system. Thank you for breaking it down for us. Thank you so much for your time. We're very grateful. And this is really helpful information. So thank you so much.
Thank you all. Thanks for having me.
Thanks, everyone. Have a great day. Take care.